If you've been easing off on the sunscreen because of the cooler temperatures, you should know that 95% of the rays that reach the Earth's surface stay at the same intensity year-round, and those rays can be deadly. One person dies from melanoma every hour. Dr. Douglas Reintgen, an oncologist from Florida Hospital and Toronto Blue Jays baseball player, Mark Sobolewski, join us now to talk about what we all need to do to stay safe and prevent skin cancer. Good to have you both here.
Thanks for having me.
Dr. Reintgen, I want to start with you. A lot of people think because it's winter time coming, we don't really have to worry about this, but we should still be slathering on the sunscreen. How much do we need?
Well, particularly in a state like Florida, where the sunlight is so intense, you really have to do that all year round. And what we usually do is have patients wear hats, wear shirts, but certainly also sunscreen can be very important. And we ask them to wear a SPF greater than 30. SPF is sun protection factor, and that would seem to prevent any sort of burning of the skin.
And now our show is actually seen right across the country, so should people in the northern states also be using sunscreen as well?
Well, not during the peaks of wintertime, although in wintertime, if you're out skiing or something like that, you can get reflections from the snow and from the ice, and so you can get a pretty bad sunburn. What people have to realize is you just can't burn your skin,
right,
and you need to be sensible about your sun exposure.
Mark, I have to ask you, you noticed what that you thought was a little unusual on yourself?
Right. Well, you know, I was shaving one day, and I came across a spot that just sort of looked like an ingrown hair or a pimple. It didn't really concern me too much. The only thing that really caused any concern was that it didn't go away. So I noticed it in September. Here I am just around Christmas time, and my fiance's mother tells me, hey, you know, you ought to go to see a dermatologist and get this checked out. I didn't expect it to be melanoma, but sure enough it was.
So what happened? What did they do?
You know, I got the phone call that it was melanoma. Immediately I got in touch with the specialist, Dr. Reintgen, in his office, and I had a meeting with him right away. A week later, I was in surgery, and thankfully it didn't spread anywhere. But it was a whirlwind of a few weeks there.
Are you okay now?
I am okay now.
How old are you?
25. I was 25 when I found out last December.
Is this unusual, Dr. Reintgen, for a 25-year-old healthy young man to come to you with skin cancer?
Well, the mean age of developing melanoma is about 40. But it's been going down through the years, and it's due to the attitude of the population in the 70s and 80s, where more people spent more time outdoors. They got exposed to a lot more radiation therapy and more sunlight, and so we really are seeing an epidemic of skin cancer and melanoma in Florida and in the Sun Belt.
And if you see anything that you suspect is even the least bit unusual, it's best to get it checked, right?
That's correct. Any mole that is changing, any color or shape, size, you know, you really need to get that checked out.
Okay. Well, Mark, we're glad you're doing great. And thanks for sharing your story.
Oh, no problem. Thank you.
It's a good morning to a lot of people out there that are watching. All right, still to come, Susan Merrill from iMom is here with great advice for parents about teaching your kids how to manage their time. We'll be right back.